Let me just thank, obviously, my great pal, Barbara Mikulski, and Tom Harkin will be coming in shortly, and Tom Daschle, of course, a great friend of ours, a wonderful senator, wonderful leader in our Senate for so many years, and leaders from organized labor. John Sweeney is with us as well, and Center for American Progress, Action Fund, the Consumers Union, Doctors for America, Families USA, Healthcare for America Now, NARAL, the National Partnership for Women and Families, National Physicians Alliance, Planned Parenthood, Service Employees International Union. I'll invariably leave someone out, and I apologize if I have, but we've got a wonderful array of organizations and groups that for years and years have been in the forefront of reaching this moment where we're on the cusp of achieving, and that is to develop a uniquely American plan to provide health care reform for Americans. This is the great nation, the wealthiest nation, with the greatest health professionals in the world. And what we need to have is a health care system that reflects all of those wonderful things that we achieved in our nation. And that is to have a health care program in our nation that serves all Americans, makes it accessible, makes it affordable, and insists upon quality of our health care. And that's what we've been involved in over these last number of weeks and days. Our plan that we passed out of our committee yesterday, it offers to fix what is broken in our health care system without ruining that which works in our nation. It offers every American choice, stability, and lower costs, no matter what their current situation is. We have a mandate from the American people. They've been waiting for years, decades, for the Congress of the United States to step up and achieve this goal of accessible, affordable, quality health care. Others have tried, every administration, almost without exception, and every Congress for almost 70 years have wrestled with this issue. It has been a difficult one. We have not succeeded. In my view, we are about to succeed. We're going to achieve accessible, affordable, quality health care for all Americans. And that's what we started to do yesterday. That's our goal. Now, we have spent a long time, Senator Mikulski and I and Senator Harkin and the other 21 members of the, there you are, Tom, the other 21 members of the Health, Education, Labor, and Pensions Committee. And one person was there with a spirit larger than a physical presence. Of course, that is Ted Kennedy, who has been dedicated his life to this issue and has fought tirelessly to bring us to this moment when we can achieve these results and goals. And so we were asked to kind of step in for him during his own health care crisis. But believe me, his presence, his spirit, his determination are very much in every dotted line, every crossed T, every syllable and every word of this bill is a reflection of Ted Kennedy's ambitions for our country. And so we thank him immensely for the work that he's been engaged in during his tenure in the United States Senate. It was a long 13 or 14 days, almost 60 hours of markup. We considered 800 amendments that were offered by our colleagues to this effort. We went through and accepted, and I'll talk about briefly, some 160 or 70 amendments to develop a bipartisan bill, because those amendments were not just technical, were substantive in nature. In fact, yesterday's final vote, I identified each and every member of the committee and what their contribution was to this bill. So while they didn't vote for it in the end, they're very much a part of the conclusion of it, and we welcome that and thank them for their efforts. What we did is establish a strong bill, a very strong bill, a sensible bill, a bipartisan bill that is absolutely essential for our well-being, and a uniquely American bill. It's a strong bill because, one, we have a public health insurance option. We believe Americans ought to have choices. We don't want to decide your doctor, your insurance plan, your hospital. That ought to be your choice. But you ought to have a public option choice as well as part of those choices, and that's part of this bill. That's why we insisted upon it. We believe in this legislation that we all bear a responsibility to share in making this work. Not any one group or one sector of the country, but all of us have to share in the responsibility. And we included shared responsibility for making sure that we all can participate in this outcome. It's a sensible bill. It's one that deals with the issue of how can we truly shift today from a sick care system to truly a health care system, where, one, we reward our system because we keep people out of hospitals and out of doctors' offices by improving the quality of their health, the longevity of their lives, as well as the stability. And I want to thank particularly Tom Harkin and Barbara Mikulski for their tireless work in the area of prevention and quality. What a job they did in developing in the legislation the areas that allow us to encourage the kind of prevention steps that will reduce those hospital visits and those doctor's visits that cost so much to our system. And they'll talk about that in a minute, I'm sure, as well, but I thank them immensely for it. Patty Murray, Jeff Bingaman obviously made significant contributions as well in dealing with coverage and dealing with the workforce issues that are so important, dealing with the waste and fraud that can occur when people abuse the system. Bernie Sanders went on at length and talking about the fraud that's occurred in Medicare and Medicaid by people abusing the system and costing us billions of dollars. I mentioned it's a bipartisan bill, and I know that some of our Republican friends don't want to admit their contribution, but they made good contributions to the bill, and we listened to literally hundreds and hundreds of ideas that were brought to the table. And some of them actually improved substantially the bill, I believe, in demanding greater accountability and ideas that could help us develop long-term health proposals that I think are going to make a significant contribution. And so I welcomed, as we all did, their participation in their work. And this is uniquely American. This is not a Canadian plan or a British plan or anyone else's. We're Americans. We want our plan that works for us and our country with our diversity, our population, our needs. And that's what we've done with this bill. It's an American response to American crisis that deserves our attention. And so I'm very grateful to all of our colleagues for doing this. We very much welcome what's occurring in the House of Representatives, the work being done there. And the President of the United States, who has said publicly that he is prepared to expend whatever political capital he has in order to achieve national health care reform in our nation. That's a tremendous commitment. I've never heard an American president make a commitment on a single issue, such as Barack Obama has made on this one. This goes to the heart of our economic problems in this nation. If you can't fix our health care issues, then you're not going to fix the economic issues of our nation. But it's fundamentally an issue about patients, about people, about that family this evening who are worried whether or not that health care will be there for them. 87 million Americans at one point or another in every year are without health care coverage. And during that free fall, they pray to God that nothing happens to them or their family, which could wipe them out financially. 62% of all bankruptcies are health care crisis related. 50% of the home mortgage foreclosures occurring are health care crisis related. It is directly involved, intimately involved with the economic needs of our nation. So this isn't some stovepipe issue of just dealing with health care. This goes to the heart of who we are, the heart of what we ought to be as a nation. And we are determined to achieve the results that we've formulated over the last number of weeks in the Health, Education, and Labor Committee under the guidance and leaders of our spiritual advisor, our champion, and our chairman, Senator Ted Kennedy.